Hi, this is Hassan Sadri again, ophthalmologist from Newport Beach, California. I'm really excited to bring our next guest on our OIS ASCRS 2019 in beautiful San Diego. This is Nancy Lurker, CEO and head of EyePoint. Welcome.
Thank you
How are
very
you doing,
much.
Nancy?
Excellent.
Are you having a good meeting?
Fantastic meeting. These
Awesome.
are great events.
So Nancy, I'm really excited both as a doctor, but also just looking at someone at Venture someone using your product. Tell us about EyePoint and tell us about what you're excited about it.
Yeah, thank you. So EyePoint just recently launched our first two ophthalmology drugs in first quarter of 2019. Yutiq, which is a retinal drug for uveitis, affecting the posterior segment of the eye, and that was just launched. And then we also launched Dexycu, which is for post-ocular inflammation following surgery. Mostly we focus on cataract surgery. But both products, what we like is they're both highly innovative and they really meet a lot of high unmet need. So we're quite excited about where we're going as a company.
Yeah, it's exciting times. I have to tell you, as a provider, I've actually had the clinical use of Dexycu last week and turned out beautifully. Tell me about your launch and some of the pluses and minuses, advantage, disadvantage. Tell us your experience about the launch and how was it launching a new ophthalmic company?
Yeah, so first of all, I'll talk more about Dexycu since this is a cataract surgery meeting. With Dexycu, we launched right around the middle of May. And since then, we wanted to get a lot of experience and have the surgeons have a lot of experience, as well as the ambulatory surgery centers. So we launched first just with our sampling program. I'm actually quite pleased to say we've had over 1,000 patients now administered Dexycu. And so far, the reports coming back in are very positive. We're seeing good efficacy and safety and side effects that actually follow exactly what we saw in the label. So we're quite pleased with that. Very, very little IOP, which is always a concern with a steroid. But probably the biggest thing is physicians are saying that they're getting very good resolution with very little inflammation following the surgery. So far the early reports are quite positive.
Terrific. And we have, I can tell you just clinically, we've had nothing but great success with the product. I'm eager to use it for other types of surgeries in addition to cataract surgery. Tell us a little bit about sort of the future of EyePoint in the space, and also how do platforms like OIS help you educate both providers and also other people in the industry on what EyePoint is all about?
Yeah, let me actually address OIS first because I come from a lot of different therapeutic areas. I have many years in the industry in mostly cardiovascular, CNS, women's healthcare, and so I'm new to ophthalmology the last 2.5 years.
Welcome.
Thank you, and I can see why people don't leave this field because it's fantastic. One of the advantages is actually OIS and what it does for that partnership between industry, in some cases the government, and then the practicing and research community. It's really unprecedented. I never saw this in other areas. And what it does is it just helps to further the cycle of innovation and make sure that you get better ideas that are being acted upon much faster. So I think it's incredible what OIS has done. I always find it very worthwhile. As for EyePoint, we've actually undergone a major transformation. It's not easy going from an R&D company, which the company was for over 20 years, into a commercial stage company. And so it's a big change for the organization. I'm actually very pleased with our team. We're fully integrated now.
So Nancy, I hear some exciting new data that was released at ARVO. You want to tell us about it?
Yes, Dr. Glenn Jaffe presented this on Tuesday at ARVO, and what it basically shows, it's our 36-month data, and this is up to a 36-month implant releasing fluocinolone, a very well-known steroid for prevention of inflammation for uveitis. And the data shows that if you look at our Kaplan-Meier curves, we continue to have statistically a very, very wide divergence between Yutiq and sham. Of interest is most of the sham patients, over 90%, were on standard of care. So it's really versus standard of care. And what you see is continual separation between Yutiq and sham, and then right around the 36th month, you can see that the implant is used up all of its drug, and you start to see a quick convergence of the two lines. In addition, I think most compelling is the IOP data, which continues to show very, very modest differences between standard of care, on average about 1.5 millimeters in pressure, and the majority of the patients were still not above 15 millimeters in eye pressure.
That's terrific.
So it's very good
so
data.
The safety profile is
Safety profile is very good, and efficacy looks very good as well. And as you know, this is the third leading cause of blindness. You really want to prevent those inflammatory flares.
Yeah, and as a practicing ophthalmologist, it's very frustrating not to be able to offer. So I'm excited to see it. Congratulations.
Yes, thank you.
Great to see you, Nancy.
Thank you very much.
Pleasure. Have a great
All
meeting.
right, thank you.